and there's only one cow out there, I don't give her the whole load. Don't unload the whole load of hay for one cow. So I'll try not to do that today. Anyway, as a doctor, I see so many emergencies, and I actually worked in emergency medicine for several years, and I was working 24-hour shifts, but I read, after several years, that the Mayo Clinic had a study that if you get sleep deprived, you have a very high risk of having diabetes because it stresses your pancreas. So people, that work in shift work and everything, they have a very high risk of having diabetes. Especially, it's not so bad if you have the same shift all the time. But unfortunately, like that energy nuclear plant where I work down in Pasco, I do all the nuclear operators there and do their physicals and everything. And it's a terrible shift. They work like 5 days on one shift, and then they have a couple of days off, and then they go to a night shift, and then they go to the day shift, and it's just terrible. I don't know how they do it. Some of them have been there for 20, 30 years. But I know it's hard on them. So anyway, I quit emergency medicine right after that, but I still see a lot of emergencies, in my practice. So I guess the thing about emergencies is that they happen so fast that before you know it, it's all over. And when you least expect it. And so I'm always thinking, when we go on a trip, when we go somewhere, I'm always thinking, okay, what are we doing or what could we be doing better to prevent an accident? And it just came into my mind as I was coming over here today. There was a situation in Walla Walla, at the city church in Walla Walla, and they took a group of young people up into the Blue Mountains and for Sabbath afternoon, had a nice outing, and mostly young people between the ages of 13 and 20, probably about Levi's age, a whole bunch of them, maybe 15 or 20, and they were going to have a wonderful time up there. And it was kind of in the spring, like right about now, and so some of the snow was melting, and so they got up there probably 30 minutes into their hike away from where the cars were parked, and there was a stream that they were going to cross, and it was only about knee deep or so they thought they could do that. And so as they crossed over, they didn't realize the rocks were real slippery underneath. And so this one beautiful girl, she was probably 16 or 17, one of the nicest girls in the church, and she slipped and fell, and the current swiftly took her down, and she got caught under a log and she drowned. By the time they got to her, she drowned. I mean, it went from an exciting, happy day, just everybody was happy, and we're out in nature, and it's so wonderful, happy Sabbath and everything, and all of a sudden, man, just everybody's crying, and her body's all limp, and they called the ambulance, and by that time she was already dead, but she got caught. It was only about waist deep, but it was real swift, and she got caught under a limb or something that was sticking out, and she just drowned. And so those are the kind of things that I try to prevent, because I would say that most accidents are preventable, but you have to be thinking about it. You can't, it isn't automatic, And many times I was driving back and forth between Pasco and Newport in Blanchard, where we live, for 5 years. I worked down there for 3 days and then come up here for the weekend and come back and forth. I saw so many terrible accidents. And, almost every one of those accidents could be prevented. And so that's what I think they say, an ounce of prevention is worth 100 pounds of cure. If you can prevent something, because frequently the accident, it might cause some permanent damage, even death. But once it's done, I mean, you can go to the best doctors in the world. You can go to the Cleveland Clinic or the Mayo Clinic or someplace and see the best doctors. But if your spinal cord is all torn, or if your leg is amputated or whatever, so, I'm used to seeing a lot of things, and it's really, really painful to see that kind of thing, especially children. And one part that I'm kind of anxious I prepared for this afternoon is about wildlife, because there's a lot of a lot of animals up here that can hurt people, and most people don't even know that they're out there. Mountain lions, you never even know. You don't know they're there. They see you long before you see them. And about 90% of all people that are attacked never saw it before they were attacked. And sometimes the bears are the same way. So I got some interesting things to show you. So I try to just pick out some of the most common emergencies that could happen in the summer. Left out a lot of things because we won't have time, like soft tissue injuries, lacerations, ankle sprains, all this kind of stuff. I just decided that we don't have time for that. So I just kind of went through a few of what I think were some of the most common emergencies. And so I know you probably won't be able to see that, but if you get a little closer, you might be able to. So the goals of this presentation is that I just want you to be able to first of all, be in good shape. If you're not in good physical shape, if you're not in good physical shape, you're in much more high risk for an accident. I don't see a lot of obesity here, but I see so many obese people and people that are taking a bunch of medicines. And so they're much more likely to have every kind of accident that there is. So the main thing is to get in shape, and we know that a storm is coming, and we all need to get in shape, do more exercise and everything. I do have a lifestyle guidelines, and if you want to just pass these around, everybody, this is just a free prescription. If you live by that, you'll be healthy, and you probably won't even need to see a doctor. I pass it out to all my patients for the several years. Just about everybody that came in the office, everywhere I go. And they're real simple things, but I think we all want to be healthy, and so put that on the refrigerator with a little magnet, read it every day, and it's like your Bible. If you don't read it, it won't do you any good. So if you put it somewhere where you can read it, well, it'll really help. So little things are what really help, not big things. It's the little things that add up to big things. So I'll try to give some practical things to keep from getting accidents. So one of the things at the end of this presentation, I have some examples here of how to make your own emergency kit. And I'm going to ask a question, and go ahead and raise your hands. How many of you have a really good emergency kit that you know how to use, you know what's in it, and it's readily available? 2 people, okay? 3, okay? So if you don't know what's in it, and in a panic situation where you have a terrible accident, you know what it's like. You can't even find the fire extinguisher if there's a fire, because we don't think about emergencies until they happen. So I'll try to give you some ideas. I got some things here, ideas of Mickey Mouse emergency kits. They're not really, they're just kind of little ones. I don't recommend them, but a lot of people use them. There's one here that's for water. So if you're in a canoe or a kayak or something, this is nice because it can get wet, but it doesn't have hardly anything in there, just something for little emergencies. But things like whistles, you need to take a whistle when you go out in the woods. You need to have a compass. This one here has a whistle and a compass, both on it. And so they even have some that are light up at night. So if you're in the woods and you get lost, you press a button and the light comes on, LED light. This one doesn't, but they have some. And this is really cool. I just found this. This is a tick nipper to take off ticks with. And it really is the slickest one I've seen. It's only about $5. I got this at Black Sheep. And it really works good because you can't kill those things. But this one you can. And it's really a good little nipper. And they have about 5 different ones. And this is the best one I found. I really like it. We do have some ticks, not like they do in Montana, those big ticks that cause Colorado tick fever and tick paralysis and all those things. These little tiny ticks here, they don't even hook on for a day or 2 usually, but there are some here. So a lot of them right now, but they'll be gone in another 3 or 4 weeks. So, And we got a head net for covering up for gnats and mosquitoes and stuff. And this is a trauma pack for stopping bleeding. This is a nice little thing to have. And then this is really cool. This is a line that you can use for emergency, but it's got one strand of jute, which makes tinder, so you can start a fire. So if you notice on this, you can start a fire with this stuff right here. And then it's got a wire, it's got another thing in it. It's 2 strands of 20-pound braided fishing line in there. So you got something to start a fire, you got fishing line, and then you can use it as a rope. So something like this is handy so you don't have to take 3 different things. And then for survival out there, I've got several fishing. This is a nice little kit. It's $23. It's got everything you need to go fishing. And you don't need a pole or anything. Things to start fires with. This is a cool light to have in your car. You've probably seen it. It has a light here. It's really bright and dimmer. And then it's got a thing to break the window so you can get out in case of an accident. And it's got a thing here that will cut the seatbelt. And when I was coming up not too long ago, right down there by Pleasant View Drive where it comes into 53, there was a head-on collision. One lady was dead in the car, and the pickup, a man was in there gasping for breath. He later died because the ambulance took about a half hour to get there, and I was in there trying to help him. But I had to cut his seatbelt because he couldn't breathe. His seatbelt was choking him. So with this right here, you can do a lot of stuff. And then it also has red light and blinking light. And plus it has this right here too, see? So it's got a lot of different things. You can buy this usually like at Costco, and North 40 might have them, some places like that. Maybe Black Sheep might have it too, I don't know, but North 40 probably has it. So those are just some things. And then this is really cool. I just found this, if you want to see what kind of animal tracks, especially in the snow or in the dust, it tells you all the different kinds of things, how you can tell a bobcat from a cougar. There's little tiny differences, but you can look at this, put it in your pocket, or even put it on your phone, and then you can see what kind of animal you're dealing with. And it has moose and elk and how you can tell the difference by their tracks. It's really cool. So it's even got some birds, so you can tell what kind of bird it is. And then look at the scat. You can tell what kind of animal it was just by their feces. So it's kind of a cool thing. It only costs about $8. It's got a lot of information on there. So those are just some things that I brought, and hopefully. And then I got the life straw, so you can always drink out of a mud puddle if you need to. And this one here was at Black Sheep. It was $18. And this was $18. I got 4 of them at Costco. Same thing. The only problem is they don't always have them. So they probably will have them again, but you just have to grab one when they have them. But that's an incredible buy. They get them in volume, and then next time you go there, they don't have it. But so those are just some things that you might be interested in. And then when you get back from your trip, you might want to put one of these on for sore muscles and joints. Slap this on. It'll make you feel better. Always take some paramedic shears. You can cut a penny in 2 with this. You can cut leather. We had an accident here on 41, right just before you get to my turnoff there by Blanchard. And there I was driving home, and my daughter was with me. This was this last year, last summer, and I saw something black laying in the middle of the road, and I thought it was a moose. I got a little closer, and there was another car stopped, and it was a gentleman that was an older gentleman, probably 75 or 80, and he had on a black leather, brand new black leather a motorcycle riding suit, and he had a head-on collision with another car, and he had his motorcycle was all smashed over there, and he was laying out there semi-conscious with pain in his belly, and leg probably broke, pelvis probably broke. And the first thing I had to do is cut off that beautiful new suit so we could see if there's something we need to know before the ambulance got there. And so I just cut that probably $800 worth of leather suit that he had on. And I said, "What kind of medicine are you on?" "I don't know, you'll have to ask my wife." And he was kind of semi-conscious. I called his wife, got her on the phone, on my mobile phone, and she said, "Oh, he's on Coumadin. He's on a blood thinner for atrial fibrillation." Can you imagine him? He's out there riding way over his head. He's got a great big motorcycle, crashed it. He died in the hospital. But we had the helicopter came, there's no place to land, so they went down on there where the elk and the bison are, down that road, and they took down the fence, and he landed out there in the fence, and so the ambulance just took him over there, and they took him in, but he had internal injuries. But so leather, you can cut boots off. I've cut a lot of boots off, motorcycle races. I used to be a doctor for the motocross races down at Washougal, and I cut the boots off of the world champion, Chuck's son. He was crashed and on one of the parts of the thing and sent him out in a helicopter. And these aren't the same shears. I should have kept them just for. But anyway, so those are just some things that you might be interested in. So every time you have an accident, you want to remember the universal precautions, because any kind of a liquid from the body, whether it's saliva, whether it's mucus from your nose, whether it's urine or feces, or in the case of a head injury, you might have cerebral spinal fluid coming out of your ear or out of your nose. Any of that stuff can be infected with HIV, it can be infected with hepatitis B or hepatitis C. And so every single one, it doesn't matter who they are. It could be a preacher's wife, it could be anybody, and they might have one of those terrible diseases. So you always wear gloves. So you need to have a pair of gloves real handy in your kit. That's the first thing. Just a plain old examining gloves. Just put them on, and that's the first thing you do, because you never, especially if they're bleeding. And if the blood is smattering or splattering around, you need to put on some glasses. You need to have a goggles in your kit, and you might have a mask. And in case of COVID, I would also have a paper gown. And I took care of a lot of people with COVID the last 2 years. And with God's blessing, we didn't have a single death. But we had a special protocol that we were doing. We'd pray for them, anoint them with oil, and put them on hydrotherapy, and they all got well. And it wasn't me, it was the Lord that did it. But so when you do that, this brings up one other point I want to make. And that is, why do you think that, I don't know, maybe not everybody here is a Seventh-day Adventist, but why do you think the Seventh-day Adventist Church has been given a health message so that we know how to live 8 years to 10 years longer than every other American? Why do you think that is? Okay. Any other? So we can make better decisions. If you think good, I mean, yeah. Help others. Okay. My whole, I really believe what I'm going to tell you right now. I believe it's not so we can live longer and brag that we have all these, we're better, healthier Americans than everybody else. It's so that the next pandemic, when it comes around, we won't be hiding behind our curtains with our mask on in our house, afraid to go someplace. We'll be going door to door because our immune system is strong, and we'll be going and helping other people. That's the reason that God wants us to be healthy. Not so we can sit around and see how much better we are than the rest of Americans that are dying of colon cancer and heart disease and diabetes and everything else. If we live like we're supposed to, we'll still get sick sometimes, we'll still die, but at least we'll have a lot better chance. So remember, always any kind of fluid or blood or vomit or anything like that, you have to be really careful with it. And it's not a bad idea in your emergency kit to have like a red plastic bag that you can put stuff like that in, blood and urine and stuff like that. Pardon? Yeah, a biohazard bag, right. And you can even get little sharp containers too to put your sharps in. So that's really important to always be thinking universal precautions. So that's with everywhere, everybody, all the time, yeah.
The little plastic bags you're talking about, when we go walking, quite often we take those little rounds of doggy bags.
Yeah. Yeah. Mm-hmm. Yeah. So when you come on a scene of an accident, or if you go to somebody's house and there's been an emergency, the first thing you want to do is assess the situation. And the first adage that you've probably heard is, don't just stand there, do something. But in emergency medicine, we do just the opposite. Don't just do something, stand there for at least 20 or 30 seconds and figure out what you're going to do. And then you won't do something stupid. So don't just do something. I mean, yeah, stand there. And so what you want to do, nobody's going to die because you take an extra 20 or 30 seconds. I didn't say minutes, I said seconds. You can size up the situation. What kind of resources do we have? Do I have somebody else to help me? Is there somebody else that just got done with a CPR class that can help me? And I might be by myself. Okay, well, in that case, there's 3 people here. Which one am I going to see first? And so that gets into triage, and that's really a bad situation, because if somebody has a fatal injury, you don't even treat them. You go to the people that are really injured and going to live. And so you have to play God, and I don't like to do that. So I always try to do everything I can for everybody, but sometimes in a mass casualty situation, airplane crash or whatever, that's what you're up against. So be careful not to act too quickly, because that's when you make mistakes. And once you make a mistake and you start going down the wrong trail, then it's going to be bad. So another thing, what I advise is that anytime you go on a trip somewhere, like in the mountains, or go for an afternoon hike up to a lake or something, before you leave, your group stay together. Nobody's going to be wandering off by themselves. That's almost always just what happens. Somebody gets lost, somebody leaves the group, and they find them later dead, So everybody's going to stay together, and then you nominate somebody to be in charge, preferably somebody that's organized and that's had a little bit of training. And then that person's the one that calls the shots in an emergency. Not that they're going to be bossing everybody around, but everybody's not going to. If you have too many chiefs and not enough Indians, it doesn't work very good. Not too many cooks in the kitchen. It spoils the food, right? So there's got to be one person that you designate. Next trip, it might be somebody else. So it isn't just playing favorites. It's you take the best person that you can and give everybody a chance. And then that way, when you have an emergency, you have planned out what to do, and you take along a few things that you might need on the way. So take a course on wilderness survival. Take a course on, the Red Cross has a Wilderness Red Cross a remote first aid course. It's really good. And you can do it online, actually, I think. And almost all the courses now, ACLS, BLS, everything you can do online. So there's no excuse for people to not get trained for that. So check the person, and basically you check them once, the primary assessment. And just remember A, B, C, D, but A, B, C, now they say it's C, B, C, A, B. So the first thing you want to do is their heart. We used to check the airway first, but people can survive a little bit longer without breathing than they can without a pulse. So they always want us to check the pulse first. And remember, when you're checking a pulse on any injured person, an adult especially, don't be checking their wrist. Don't ever do that. Because in a shock situation and they're bleeding, you probably won't even feel a pulse, because the body is trying to get all the blood to the center, your organs, to your heart and your lungs and your brain. So the place to do it is on your carotid. Now, when you go up to check somebody's pulse, carotid pulse, there's a lot of times there's going to be a bunch of people around. So what you want to do is have crowd control. So you'll nominate one person to keep everybody back and to be in charge. Maybe somebody else, they direct traffic. Somebody else just say, could you please call 911, have them bring an AED, automatic electrical defibrillator, and then let me know. And so you delegate some stuff if there's people around. But when you get down to check the patient, this is really important. First of all, if they're awake, you have to get their consent. You say, can you please give me your consent? I'm trained to help you, and I'm not going to do anything to hurt you. I'll be really careful. I care about you, and is it okay if I go ahead and examine you and treat you till the ambulance gets here or whatever? And if they say no, well, then you wait till they pass out, and then you can treat them without consent, But it's implied consent. Once they pass out. Now, if it's a child that passes out and the parents say, don't touch him, I might have to take the parents and do something to them and then take care of the kid, because it's not fair for somebody to say, don't touch my kid because he's choking to death. I've never had it happen to me, but I'm just saying, you still ask for their consent, even though the kid is unconscious. So the bottom line is that you always try to check the pulse first. And in a baby, babies have a big head and a little body compared to adults. Adults have a big body and a little head. So they have a longer neck, so it's easy to check the pulse. With a baby, you can't even hardly feel the carotid pulse because their head is real big compared to their small body. So we always check a femoral pulse. You might have to pull the diaper out a little bit and just feel right in the groin area, and you'll feel the pulse bounding there. And another place you can do it is the brachial pulse right here. And you can feel them. But don't check the radial pulse on anybody. And then don't check, and then check in the groin, in the femoral pulse or the brachial on infants. Now they made it easy. They used to have infants were up to 1 year, and then children were up to from 1 to 7 years, and then after that was adults. Now it's just infants to 1 year, and then everything else is adults. So that's as far as choking and everything. They made it easy because you're trying to figure out, okay, is this kid 13 months or is he 11 months? What am I supposed to know? Just, use your head and just say, okay, whatever. So the other thing I was going to say something about the checking them immediately, and that is, then you want to check their airway. And when you do the airway, what you want to do, check two things at once if they're breathing. So say the patient's laying down here, his feet are that way, and so I get down and I want to see if they're breathing. They're unconscious, but I want to see if they're breathing. So I get down and I put my ear right on their mouth, almost touching, and then if they're breathing, I will feel the air on my ear. And at the same time, I'm looking at their chest, and if their chest is going up and down, and then I put my hand on the chest to feel if it's going up and down. But believe it or not, when some people are taking their CPR test, I say, please check their breathing. And so they go like this. They put their ear down, they're looking off into the valley somewhere else. They can't see the chest, they can't feel the chest. So what is that? So just make sure if they're laying the other way, just always be looking at their chest. And put your ear and be looking at their chest, feeling their chest, and then you know if they're breathing or not. And if they're not breathing, then you got to do something about that. You got to give them rescue breathing, okay? If they don't have a pulse, or if it's a weak or thready pulse and they're unconscious, then what you might want to do is go ahead and do a start CPR, start chest compressions. So those are the things. And then just because they have a pulse now and they're breathing now, 5 minutes later they might not. So observe very, very carefully. Don't just forget about it and say, oh, they're doing fine. Also remember that when children have an accident, they take longer to crash and go into shock. And so you might have the situation where everybody else in the car crash is laying around moaning and groaning, and the little kid's standing there crying. We had that happen up in Tollgate down by Walla Walla up on the mountain. And they said when they got there, the mother and the father were all severely injured, and one of the other kids was severely injured. And this one little girl was just staying there crying. And so they grabbed her, and they were just ready to take off. And they said, oh, I guess she was in the accident too. So they put her in the ambulance. She crashed on the way down. She quit breathing. And her tummy was filling up with fluid. She had a ruptured liver and spleen. When they got to the ER, I worked on her for 45 minutes with 3 other doctors that I called. And she died because we were putting in blood fast. She was bleeding faster than we could put it in. But what happened was, because she didn't crash as soon as everybody else, because she's a kid, she's got strong circulatory system. Now, women, they're pregnant the same way. Pregnant women have about 30% more blood after they're about the second trimester, second 3 months of the pregnancy. They'll have a lot more blood on board because they got the baby to supply the blood for. And so they won't go into shock as fast. But when they go into shock, then it's serious. So be sure and keep those 2 things in mind. Pregnant women and babies, you have to get on it right away, because if they're going to shock, they're going to wait longer, but then when they do, it's going to be more serious. So then the other thing is, don't miss any part. After you check them, and let's say they're breathing and they're alert and everything, and let's say they have a terrible injury on their jaw. Let's say that they have a gunshot and their jaw is hanging off. But they're alert and they're breathing. And you examine them, and we give a doctor a test. You know, sometimes we use moulage victims. They're live people. We pay them to go and pretend that they're a patient, and we tell them what to do, and then we test the doctors to see if they know how to do it. And so we have a patient there, there's a terrible injury on their jaw, and the doctor, you say, what did you see, doc? Well, yeah, this is a terrible injury, and, you know, I got to stop the bleeding, and what else do you see? Well, you look around, and that's the most obvious thing. They're distracted by something that isn't the main problem. And so they say, well, do you see anything else? And they look down, and they don't see that the legs are all straight. And they say, can you move your toes? And so the person moves their toes. And they say, well, I guess that's it. And they say, okay, turn the patient over, and there's a knife sticking in their back that they missed. So one of the most common problems is when you check a patient that is injured is you get distracted by one thing and you miss something else that may even be more important. So it's a pearl. I'm going to give you a pearl is like something that it took a long time for some doctors to learn something, and they pass it on because it's only by a college of hard knocks that you learn those kind of things. So, but I'll try to give you a few pearls now and then so it'll help you when you're examining somebody. Always call for help right away if it's a serious situation. And as a general rule, if there's a car accident and anybody died in it or is unconscious, every other person in that car is going to go to the hospital and get evaluated because they might also not know it and they might be severely injured. They might have a ruptured spleen. In other words, if the car crash was bad enough to kill one person, everybody else in there might have a serious injury and not even know it. So they'll say, oh, no, I'm fine. I'm not going to the hospital. Yes, you are going to the hospital. For sure you're going, whether you want to or not, because this person died and you could have a serious injury that you don't know about. So that's another little pearl that you want to remember. So deciding whether to transport, that's a hard situation sometimes. If you're out in the boondocks and you're hours away, and have an injury? Is this something that can wait? A laceration? Is there a broken bone? Is there an ankle or something that's twisted around? The foot's going the wrong way? What's the injury? And so if you have a cell phone, you always should have a cell phone. And incidentally, it's a good idea to have a solar-powered battery bank. They have them at the Beyond the Grid there, Outfitters in Newport, for about $35 or $40. And you can charge it up. The solar panels open up. I don't know if we brought one. I think we do have one here. Yeah. And so what happened is that you carry that around, and if you have your cell phone, always tends to go out when it needs to be charged, and you don't have your charge. Just have that with you all the time. And so what you want to do is have your cell phone and call for help right away. But if you still don't know what to do, well, then you have to pray and just make a decision. And if you make a decision, you have to decide, are we going to extricate fast or slow? If it's something, they've got a ruptured tendon in their hand, there's a cut and the tendon is cut. Okay, well, it's going to need surgery. But it doesn't have to be done in the next 10 minutes. We don't have to call the air ambulance to come right now and land out here in the woods. This is something that in 3 or 4 days, we'll keep it clean, we'll put some antibiotic ointment on it, and when they get to the hospital, then they can fix it. But if it's something serious, like a neck injury, where they fell off, dove into a pond and hit the rock underneath the shallow water or something, that's got to go right now. And if you have to, then you might have to take them out. And we've had situations. We had one boy that dove into the river out there in the Snake River at the park, and he dove in, and the water was only about 2 feet deep, and it's usually about 5 feet deep, and he just ran and dove in and hit his head, and he couldn't move his neck. So we literally had to take a board and put in the back of my van, and we took him to the hospital, and I held his head all the way in because we didn't have all that. immobilization things for the neck. Because if they have a neck injury, then that's serious. You got to prevent. You pillows or use something and then tape it and make sure that they don't move all the way into the hospital. So, okay, so be especially careful not to injure the patient further. So if they're already injured, one of the things is don't do any further harm to them. If they have a possible neck injury, don't paralyze them by moving their neck or jerking on their arm or their leg or something. And keep the patient warm and comfortable. In the case of the summer, if it's 110 degrees in the shade, keep them cool. Protect the neck and spine if there's a suspicion. How do you know if somebody might have a neck injury? Well, if you're walking down the sidewalk and you see a ladder that's laying there on the sidewalk, and you see a bucket of paint, and you see some guy laying there that can't move, what do you think happened? I mean, he obviously fell off the ladder. What if you go out in the field, you call to an emergency, and there's the horse standing, the saddle's hanging underneath instead of on top, and the lady's laying there, can't move. She's probably got a neck injury. She fell off the horse. And the horse didn't run all the way to the corral. It stayed there. But it's not, you have to think. What happened? That's called the mechanism of injury, MOI. The mechanism of injury, you always want to know, how did this happen? What happened to you? And then you want to know if they're alert or not, so. Okay, so protect the airway, control bleeding. Okay, now we're going to start with the first emergency, and that's allergies. Do you know that more people die in the United States from snake bites and bee stings and things like that than they do from getting killed by a mountain lion or a bear? Those are kind of things that you can, if somebody's allergic and they get stung by a bee, they can die right within minutes. And the only treatment is adrenaline, epinephrine. And so it's not a bad idea to have a little vial of it in your case, in your kit, because you never know. And another thing is you can get those little asthma inhalers. You have to have a prescription for it, but if you know somebody that has asthma, tell them you want to have one that's half full in your emergency kit, and they can go buy another one or something, because they're kind of expensive. But it's an inhaler, and when if somebody has an allergic reaction and they can't breathe, they're wheezing, that means their airway is squeezing down. And you give them one of those inhalers from an asthma inhaler, and immediately they'll be able to breathe. And then if you give them a shot of epinephrine, then they can, that's the way to save their life. So one of those emergency EpiPens, they're called, epinephrine, it's an automatic pen that costs about $800, $700 or $800. It's crazy that the pharma companies are just, ripping everybody off. I can remember when it was $100. But if you have one of those, you just take it off and jam it right in the leg anywhere and go ahead and give it. The right dose is right there. Just give it, and you can save their life. So you should have one of those in your kits and have it run in the home. You can ask your doctor to give you a prescription and just have one. Now, an alternative, if you don't want to pay that kind of money, you can go and have your doctor order some epinephrine. Comes in a little vial, and then you get a syringe. You can buy them at the store for animals. They're the same ones, just a sterile syringe, an insulin type syringe. And then all you do, you get a needle that comes with that, and when you have an emergency, you snap open that little ampule, you draw up the adrenaline and give it to them. It takes you about 15 seconds. And now instead of spending $700, you just spend about $2 to get that epinephrine that way. So that's just a way, I'm trying to give you ways that make it possible for you to have a kit, okay? So allergic reactions can either be mild or medium and severe or real severe, life-threatening. The worst case scenario is when they go into anaphylaxis. In anaphylaxis, their mouth will swell up, the tongue will stick out, they can't breathe, they're wheezing, and they're dizzy, and they're all swelling up. And it's a bad situation. And if you don't have epinephrine right away, they're probably going to die. But you can give antihistamines. You can get some antihistamine tablets over the counter for their 25 milligrams or whatever. They're real cheap. Benadryl, you can get some of that. And the only side effect with Benadryl, it makes people sleepy. So if you give somebody, a normal-sized person, 50 milligrams, tablets, within about 15 minutes, they'll be a little bit drowsy. But yeah.
I think on the Benadryl, the sleep aids that you can get from Walmart are exactly the same.
Yeah, it's the same. It's diphenhydramine. If you just look at diphenhydramine, it's Benadryl. And actually, liquid Benadryl, most people don't know this, even a lot of doctors have never heard this. Liquid Benadryl, which you can get for children, that is a local anesthetic. Yeah, and you can actually use that when you don't have anything else to numb something up. Like in your mouth or something for a cut, you can numb it up a little bit before you suture it. So there's a lot of little tricks that you can do. But so usually they'll start itching all over, and then they have what they call urticaria. Urticaria just means hives. They're blisters all over, and they just itch like mad all over the body. That's an urticarial reaction. In the feet, yeah, bottom and the palms and everything. And so usually somebody, if they've never been bitten by stung by a bee, they won't have an anaphylactic reaction. But if they've already had some antibodies building up to it, then the next time they get stung, so they always need a kit. They have a kit to take with them. And there are people that carry those kits with them everywhere they go to save their life. So you can get that, a prescription. So you can see here swelling of the tongue, loss of consciousness, rapid swelling of the throat tissues. And see up here, this is almost closing off the airway. See here? Here's the airway. It's almost closed off. Look. The tongue is swelled up. We had a mission trip down to Nicaragua, and we went to I was supposed to speak at a evening meeting out there in this barrio. It's a bad part of town where drug dealers and everything were. And so we were there, and my part was the last part. It was after an hour of showing the religious part of the PowerPoint presentations from the young people. My turn was to go and do the medical part. And after I did the medical part, everybody had been there about an hour and a half or 2 hours. And people were leaving, and this lady came up. She said, "There's a lady here that needs to have a medical consult. Will you help her?" And I said, "Sure, what's the matter?" She comes up, and her tongue is hanging all the way out of her mouth. Her lips are all swollen. She's kind of dizzy. I said, "What happened?" Scorpion got her. I said, "When did this happen?" "Well, it was 2.5 hours ago." And I said, "Well, why didn't you tell us at the beginning?" "Well, because I wanted to hear your presentation. And I was afraid you'd send me to the hospital, and I wanted to hear what you guys are talking about, the Bible." Wow, if you got bit by a rattlesnake, would you rather listen to the evangelistic meeting, or would you rather go to the hospital? Down there, they're hungry for it. And so I said, "Okay, get in the car quick." And so we took her over back to the hotel, and I got my medical bag, and I gave her a shot of epinephrine, and I gave her some Benadryl, and then we had prayer for her. And within about 30 minutes, the tongue just went right back in the mouth. I mean, she couldn't even talk. Her lips came down. And so we gave her some more Benadryl pills to take. But it's amazing how fast an antihistamine will work. But you got to be careful, because they can have a rebound, and she could drive home and have the same thing happen again. So you got to watch them for a while before you send them home. But if you're out there, it's a good idea to have some Benadryl tablets, also used for motion sickness. Dramamine sometimes will do the same thing. It's an antihistamine. So those are all the things that can happen with anaphylaxis. So this is a lady with anaphylactic shock. Lips, everything's swelling up. Here's a baby. See, it's pretty hard to check a carotid pulse on a baby like that, right? Because their head is bigger than their, and you just can't do it. So the key takeaway, it's an acute, severe, life-threatening, systemic allergic reaction. Epinephrine, epinephrine, epinephrine. You can remember adrenaline, it's the same thing. Epinephrine is another word for adrenaline. So for mild, just for a rash, like say they get into some poison oak or poison ivy or something like that, they just have a itching allergic reaction. Maybe they ate some shellfish. You know why people get allergic reactions to shellfish? Because of the iodine in it. Shellfish, crabs and lobsters, they have a lot of iodine in their body. And so people are allergic to iodine. Shellfish is a real common reason for people to have allergic reactions, but usually not a life-threatening. It's usually just, a mild reaction. And so you avoid that kind of stuff, but you can just give them some antihistamine, and if they're not having any swelling in their mouth or throat, no trouble breathing, you can just tell them to get some hydrocortisone cream, 1%, at Walmart or any drugstore over the counter, 1% hydrocortisone cream, and that will work perfect. And it's you don't even need a doctor's prescription for that. So for a mild allergic reaction, you can use a mild antihistamine like Benadryl or Dramamine, and then you can use a hydrocortisone cream. Now, what if you don't have that? Then you can use aloe vera and you can use stuff like that, but what you really need is to get that under control. Yeah, question?
In the first aid kits, be sure that they're not latex. Like with me, I'm allergic to latex. And that's really important not to have latex.
Yeah, there aren't too many people allergic to latex, but you could check it before you buy it. That's a good thing. Some of the gloves that are not latex are harder to find sometimes. Some of the nurses have trouble at the hospital that are allergic to latex. But usually they just get a rash on their hands when they do that. And also remember the asthma inhalers. They work really good for allergic reactions if they're having trouble breathing, because in the airway we have muscles around the airway, and when you have an asthma type or a wheezing, then the muscles are tight in the airway and it closes off the air breathing, and there's inflammation that develops. The membrane inside of the airway gets inflamed and the mucous membrane gets thick. So you got the thick mucous membrane inside, and then you got the constriction, and so basically the air can't get through. So if you can get one of those inhalers, like an asthma inhaler like albuterol, they're kind of spendy, but if you know somebody that has asthma, they can probably get one for you, or your doctor can prescribe one just for an emergency kit. And you can get a generic albuterol one, and it probably costs you $50 or $60, but somebody can, if they have insurance, they might give you half of one of theirs or something, and you have one with you, so it comes in handy for that. So basically, most people, even asthmatics, they don't know how to use their inhaler. I mean, I can't believe it. People that have had asthma all their life, and they come in, first time I'm seeing them, and I say, how you doing? Oh, I'm doing good. I just need a refill on my medicine. I said, well, you use your inhaler? Yeah, how often? Oh, I use it about once or twice a week. And I say, well, can you show me how you use it? And they say, oh, sure. And so they go, I said, come on, use it. That's not the way you use an inhaler, but they don't even know how to use it, and they're using it for years, and they wonder why it doesn't work. So the way to work, what they have to do, is you take your finger and have it ready for the trigger. It will spray it out, okay? And so you have them let all their air out, all the way out. Put this in your mouth. Hold it for 10 or 15 seconds. Now that medicine's going all through your lung right where it needs to be. That's what they use when they're taking drugs. When they smoke marijuana, they don't go like that. They take a nice big deep breath and hold it and let that drug go all through their body, and then they feel high, or whatever. So when we're using the medicine, you have to use it rightly. You have to use that albuterol correctly, and they have to be reminded, because they'll say, okay, I got it. And next month they come in, you say, okay, show me, and they still aren't doing it quite right. So I don't know, there's something about it. Okay, our second type of injuries are heat injuries. And the predisposing to heat injuries, if you're obese, if you're diabetic, if you're out of shape, if you're dehydrated, if you drink alcohol a lot, or you have been drinking, or using drugs, illicit drugs, if you're using a lot of restrictive clothing and it's real hot outside, if you have a sweat gland abnormality, some people have a problem when they don't sweat properly. They have to condition called anhydrosis, where they can't sweat normally, and so they're predisposed to having heat problems. And cystic fibrosis is a problem in the pancreas and all over, and they have trouble with heat. And if somebody has quadriplegia, have a neck fracture or something, and they're paralyzed, they can't handle heat because their whole nervous system that controls from their spine to their extremities doesn't work properly. So these are the kind of people you'd be more susceptible to. So if you see somebody in a wheelchair that's quadriplegic and it's 110 degrees out, make sure they have an umbrella over them and they're given plenty of water, because they're going to be in deep trouble if they're not careful, okay? High-risk occupation. So athletes tend to be dehydrated and they tend to get heat problems. Construction workers, where they're having all kinds of problems. We were down in Nicaragua on that same trip I told you about, and some of the team over there was in fact, I won't tell you his name because he goes to the Hayden Church. And so I probably gave it away by saying that. But anyway, he's a friend of mine I went to school with at Walla Walla, and he was up doing the working, putting in bricks and everything on the building the church. And I was doing the training with a bunch of other people. And pretty soon people came and said, oh, you got to do something with him. He's acting crazy. He's bossing everybody around. He's not talking right. Something's wrong. Well, he was having a heat exhaustion. And he was just out of it. He didn't even hardly know who he was or where he was or why he was supposed to be there. And so I made the executive decision to take him off of the job, and he wasn't happy with me. I said, come back to the hotel and buy the air conditioner and drink plenty of fluids, and we'll see how you do. And a couple of days later, he was feeling better, so I said, okay, now you can go back, but drink a lot of water, have your water right there, and I want you to wear a hat and roll up your sleeves so you're not going to be all hot again. And we ended up being good friends again when it was all, especially when we got back here to the States, and he forgot about it, I guess, I don't know. But he was not happy with me because he wanted to keep working, but no one else wanted him to keep working because the way he was talking to everybody, that's not himself. He was not acting his normal. Oh, also, workers in mines and the new military recruits. When they go to boot camp, they just work the tar out of them, and they run them, and they have to get up every morning early, and they work hard and run, and some of them get heat exhaustion and pass out and everything, and so they're high risk. So sunburn is another big problem, and the sun is divided into a spectrum into C, B, and A. UVC does not reach the Earth's surface, so we're not concerned about that. UVB is what burns human skin. It's called the sunburn spectrum. And UVA has wavelengths that are about 100 times less apt to cause sunburn. So it's mostly UVB that we're worried about, okay? And so it can be mild or severe. And what usually happens, I've seen it over and over, is people go to Hawaii and they're so excited, you know, and they see these beautiful beaches out there and the white sand feels like powdered sugar on your feet when you're walking out there with your girlfriend or your wife or your husband or whatever. You're just so happy. And so you go out there and you either have a bikini, or if you're an Adventist, you probably have a more modest bathing suit. But within about 2 or 3 hours, you're burned to a crisp. Literally. You're just toasted. And so now you spend about the next 3 days in your hotel nursing your pain, taking some ibuprofen, putting hydrocortisone on your sunburn. So the bottom line is, if you look around, the Hawaiians, they never go out after about 10 o'clock. They don't go to the beach until about 3 or 4 in the afternoon. Why would they want to go out? And even though their skin is darker, they don't want to get burned. They're smart. But we go over there now, and we go out there and just get crisped out and ruin your whole vacation. So do a little bit gradually and use some kind of suntan lotion. Some people are allergic to suntan lotion. You can get a rash just from that. So when you're out there in the hot sun, use a hat, a wide brim hat. They have them in REI, and even in Costco and Walmart and North 40, they have these big hats, you know, and you can have sunglasses, and you keep your arms covered up. and your legs covered up, and then you don't get blistered, so. There are 6 types, not 66 types. That's a typo. There's not 66 types of human skin. It's 6 types. At least it didn't say 666, right? Type 1, always burns, never tans. That's the way my dad was. My dad had freckles, he had light skin, and when he went down there and he was out there in the Amazon and all those places as a missionary, and he would just get burned all the time. And sure enough, when he was about 70 years old, he was going in every other year to get his skin cancers taken off because he just damaged his skin. He was born that way. It wasn't his fault. And type 2 always burns, sometimes tans. Type 3 sometimes burns, sometimes tans. Type 4 sometimes burns, always tans. Type 5 never burns, sometimes tans. And type 6 never burns, always tans. That's what everybody would like to have, right? And so the worst thing what you want to do is don't go to the tanning booths. That's a craziness, total craziness. It's vanity and craziness. It's a sunburn city when you do that. Cancer city, skin cancer. So please be careful. We need a certain amount of sun. Some people think that sun is bad. And they say, oh no, sun is really bad. You don't ever want to get in the sun. Well, yeah, you want it, but you only need about 10 or 15 minutes of good sunshine every day. Now, if you live north of Los Angeles, up in this part of the country, we're not going to get enough vitamin D no matter how much you are in the summer or anything. So you need to take some vitamin D. So I would advise everybody to take some vitamin D because we're just not getting enough sun making vitamin D up here because we're too far north. Okay? So long-term sun exposure, the skin looks wrinkled, blotchy, rough, irregular, weather-beaten, and may have telangiectasias, just like little blood vessels, look like little spider veins going all over. The skin is just ruined from too much sun. I was a lifeguard when I was back in my prime, in the dark ages, I guess it was. And you know what we used to do as lifeguards back then? We put baby oil on. We lathered up with baby oil, and man, we would get so brown, and they'd think, man, we're Hawaiians, man, we're just cool, Just burned and terrible, our skin, They didn't even have, back those days, they hardly had any suntan cream. So we just lathered up with baby oil, and it smelled good too, and we'd be out there, man, all brown and everything, and just ruining our skin. So fortunately now, we're smarter than that. And fortunately, I didn't have any skin cancers yet, but I tried to be more careful, and I usually wear a hat or something, so. Treatment, acute sunburn, cool tap water, steroid lotions are helpful. 1% hydrocortisone cream for 2 or 3, 4 days. It's not going to hurt anything. You don't absorb very much. You buy it without a prescription, over the counter. No problem. It's cheap. You can use aloe vera. It's not quite as good, but it's soothing. Prevention of sunburn, protective clothing, wide-brimmed hats, long sleeves and pants, and just simply don't go out in the middle of the day. Let's take a lesson from our Hawaiian friends. They don't go out there when the sun is beaten down. They wait. Man, they bring out the ukuleles about 3 o'clock, and get everything going. But they don't go out. All the Americans are out there burning, all day. And when it comes time for the luau, they're home in the hotel putting on the suntan, the solar cane spray, to take away the pain and ruin their vacation. So heat edema is a self-limiting process where you just get some swelling of your legs and feet and hands. And sometimes you're sitting in an airplane going over on a mission trip, and you get there and your feet you can't even get your shoes on. It's a self-limiting thing. There's also prickly heat. You'll have itching and stuff. They used to advise putting powder on, but now they say don't even do that. Just keep your feet elevated as much as you can in the plane. But when you sit there for 9 hours in the toilet section in the back where it's cheap, the cheap tickets, and you got your knees on your chin for 9 hours, it's really, really bad. You're going to have feet swelling. And so I prefer not to sit back there anymore. I don't enjoy that. Usually this resolves in a few days, but it might take up to 6 weeks. No treatment is necessary. Prickly heat rash, the same thing. So you wear clean, light, loose-fitting clothing and avoid sweat-generating situations. Avoid too much talcum powder or baby powder. And you can use chlorhexidine, light cream or lotion. You can use something like CeraVe, CERA-VE. It's really a good moisturizing solution. You can put that on. That will help it feel better. Heat syncope. Now we're going to start getting some more serious things. This results from when your blood vessels dilate in your periphery of your body, and you have a decreased vasomotor tone and relative volume depletion, so you actually get dehydrated. Usually occurs in unacclimatized persons during the early stages of heat exposure, which is in the first part of the summer before you get acclimatized to it. Or if you go on a mission trip, when you first get down there. Treatment is you remove the patient from the heat source, give oral fluids, if necessary, IV fluids, and prescribe rest. Most patients recover just within 2 or 3 days. Heat cramps, and that's a little more serious. This is usually athletes. You have painful involuntary spasms of your muscles in your abdomen and your legs and your feet and shoulders, but you don't have a fever. It's not usually serious. It's usually during exercise or after several hours after exercise. It's caused by not enough sodium, potassium, and fluid in the muscles. The person loses sodium in the sweat and doesn't drink enough. So there's something else. I'm not promoting Costco here today, but there's something else that you can get at Costco that's really cool. It comes in the pharmacy section. They're rehydration packets. And you get a bunch of them for like $20 or $30. And there's about 20 or 30 of these packets, and they have different flavors, berry and stuff. And you just take that out, put it in a bottle of water, and when somebody's dehydrated, it's really good to rehydrate. Don't take pure salt. Don't take sodium. You don't want to do that. The individual's usually been sweating liberally and drinking water. There's no evidence of dehydration, but they just have cramps. So the treatment, you rest in a cool environment, give them fluids and salt replacement, and you use the electrolyte sport drinks. But most of those now, Gatorade, it's just pure sugar. Gatorade used to be really good, but now it's practically pure sugar. So I recommend those rehydration packets. They're better than Gatorade. Do not use salt tablets alone. They irritate the stomach, often cause nausea and vomiting, and they don't replace the fluid volume. Heat tetany. Now this is where you're just like a spasm for the muscles. Usually seen after intense periods of intense heat stress, characterized by hyperventilation. Somebody's breathing too fast. And when somebody breathes too fast, that's called hyperventilation. And pretty soon they'll start to tingle, their feet, their hands. They blew off all their carbon dioxide, and now they're starting to pass out, and they get panicky. They think they're having a heart attack, and their fingers are tingling, and their feet are tingling, and they get scared. And all you have to do is put a paper sack over their face, tell them to breathe in it for about 2 minutes, and they'll be fine. You tell them what you're going to do ahead of time. Which reminds me of one thing. When there's a crowd and you're doing some kind of emergency treatment for somebody, always, remember this, always say what you're going to do before you do it. You talk your way through it, not listening to the crowd. You're just talking out loud. Now I'm going to check the carotid pulse. And then you do it. And when you check the carotid pulse, you don't ever want to do this right here. If I'm going to check his carotid pulse, I don't want to go like this. Because somebody's going to say, you're choking him. What are you doing? So why do we do it? I go, I check it on here now. See, I'm fine. Oh, he knows what he's doing. Or over here, I do this. Don't do this because people looking on, you're choking him. Stop. So what you do is you speak out loud to the crowd, but without looking at them. You say, okay, now I'm going to check their pulse. Incidentally, how long do you check the pulse for? 6 seconds. All you have to do right now, because we're just in an emergency situation. We don't have all day to be checking their pulse for a minute or two. No, just 6 seconds. If I count 6 pulses in 6 seconds, I put a 0. His pulse rate is 60 per minute. If I get 8 in 6 seconds, it's 80 per minute. If I get 12, it's 120. If I get 14 pulses in 6 seconds, 140. Now you don't have to waste time. You can go on to your next part of your exam. So that's something that it'll save you a lot of time. Now, if you're worried about the heartbeat being irregular or something, yeah, then you're going to have to take time and listen and check then if it's erratic, and maybe they have atrial fibrillation, and so it's not regular. And but if you're just checking to see if they have a pulse, you want to know what the pulse rate is, just do it for 6 seconds, okay? So now, heat exhaustion, now it's going to get more serious. You have symptoms of fatigue and malaise, severe headache, lightheadedness, dizziness, and muscle pains. And he was going, the man down there was going from heat exhaustion into heat stroke. He just about had a heat stroke. That's how bad off he was, because he was a little bit psychotic. I mean, he was delirious. He didn't even know what was going on. The one I took off of the work crew. So the body temperature is normal with heat exhaustion. It could be up to 104, but it usually isn't over that. It's usually not up. And you don't always have a thermometer, so when you check somebody's temperature, just use the back of your hand. Don't use the palm, because your palm is thick and you can't feel as well heat because you're callous on your hands. So just check it. And I can tell just by experience, I can tell if somebody has a temperature of 101, or do they have a temperature of 103, or do they have a temperature of 106. I mean, either they have a little bit, a lot, or just in between. So it's easy. But just check, and just check with your, and not necessarily on their forehead, but just on their neck or on their cheek or somewhere, okay? Now, what happens in heat exhaustion, they have a rapid heart rate. Normal rate is 60 to 100, approximately. So if their pulse rate is maybe 120, 130, and they're not running, because normally when we run and exercise, our pulse rate goes up, right? But if they're just laying there and their pulse rate's 120 or 30, usually their pulse rate will go up like 10 points for every degree that they have a fever. That's something to remember too. People that have a fever will naturally have an increased heart rate. And that's not normal. That's normal. It's not bad. So they have a normal neurologic exam and a normal mental status, okay? But they're getting sick because they've been exposed to too much heat. So you give them rest, volume, and electrolyte replacement, and sometimes you even have to give them IV solution just to hurry up and get them feeling better. Okay, now we're going to get to the big one. Major heat illness, heat stroke. A true medical emergency, it may result in widespread organ system or brain injury. It is caused by a complete breakdown of thermal regulation. The patient has had so much heat that they can't regulate their heat anymore, because we have normal mechanisms in our body to regulate our temperature. Usually occurs in summer heat waves in the poor, elderly, and chronically ill people. So when you read about these people back in New York and the ghettos in Chicago that die of heat stroke, it's usually because they're poor and they don't have air conditioning and they're probably not real healthy, probably homebound or something, and their air conditioning doesn't work. It requires immediate intervention, since there's a high potential for mortality. Up to 40% of people with a heat stroke will die. So this is time to get off. It's not just to stand there, but to do something. Really, now we have to do something. Classic triad, usually the body temperature is over 105. Usually the patient's not sweating. They can't sweat anymore because they can't regulate their heat anymore. The skin is red, hot, and dry, and they have CNS dysfunction. That's where he was. He wasn't thinking properly, so. Treatment of heat stroke: rapidly cool the patient, move them to a cooler environment, remove restrictive clothing, immerse the patient in cold water if possible. If you're up in the mountains or something, you can put them in the creek or pour cold water over them. Whatever you have to do to cool them off. And one thing we used to do, but we don't do it anymore, is they put the alcohol bath and put a fan on them. Man, you can really cool them down quickly, but sometimes too fast. There was a time when the doctors used to do that, but now it's kind of frowned upon. because you can lose you can just rub them with alcohol all over and put a big fan on there, and boy, within about 5 minutes, their temperature's going to go down. So we prefer to do it more safely and slower. Then we don't do that anymore. At least I don't. Give them cold water to drink, but don't ever try to give somebody oral fluids if they can't swallow, if they're unconscious. That's a no-no. They can't protect their airway if they're unconscious or partly conscious. Okay? Do not give fever-reducing drugs. Don't give them Tylenol and aspirin and stuff like that. This is serious. You got to give them fluids and cool them off. Evacuate as soon as possible. Follow up with a healthcare provider. Okay, burns. There's superficial, partial thickness, and full thickness burns. Painful, and I'm not going to go through too much on the burns. The first degree sunburn. This is a hand burn, second degree. Second degree burns have a blister. So if it's just red, but there's no blister, that's first degree. If there's blistering, you'll see them just like that. You don't want to do it, but if you poked a needle in, fluid would come out. We don't like to pop the blisters because they get infected. It's better to leave the blisters there. You're attempted to just pop those. No, leave them alone. You don't want to get them infected. A third degree burn now is much more serious. This is a second degree burn because you see the blister formation. There, look at that. Severe hand burn. Look at that one. That's a third degree, probably electrical wire. So Levi, be careful because that's what happens. He's working as an electrician now, learning a lot, and I'm happy that he's got a good job, but you got to be really careful because most, especially people that are learning electrical stuff, they forget something and all of a sudden, bang, they get burned. Like something like this, or like this one. This is bad. Chances are he's going to lose fingers on that one. This is another bad one. Something hot poured all over him. So we check the body surface area. I'm not going to go into that right now. And if they have burns to the face or neck or soot in their mouth or nose or singe facial hair or nose hair, dry cough, they automatically go to Seattle to the burn center. They won't even take care of them here in Newport or Coeur d'Alene. They'll usually send them right to the burn center. Because most people in a house fire die of smoke inhalation. And it just gets soot in there. Literally just black soot just gets in their lungs. Terrible. I hate burns. It's one of the worst things to take care of. Now, one thing I want to show you this is something I just recently learned. And guess who taught it to me? Rachel Urbeta told me this. And then I heard it from some other people. Some of the firemen even do this. Egg white works perfect for first and second degree burns. It can almost clear it up overnight. Better than aloe vera or anything else. Make sure they're vegetarian fed eggs. I'm just joking on that, but the bottom line is that egg white really does work, even better than aloe vera. So remember, that's just a trick. And sometimes they say they put the burn right and just cover it with flour. It can be white flour, it can be graham flour, whole wheat flour, doesn't matter. Put it in there for a little while, take the heat off, and then you can put some egg white on. I mean, those are some things when you don't have any access to medical care, you can do this. Care for burns, okay, I'm going to get over there. Lightning strikes. Prevention. Pick a campsite that meets safety precautions, check weather pattern, forecast, plan turnaround times to get out if you have to. So you go on a nice camp out and you get up to Priest Lake and all of a sudden there's a big thunderstorm coming in. You guys better be getting out of there right now. Don't stick around and have lightning and thunder. So here's what you want to do. You always move downhill. Do not stay in a meadow or an open area. Seek uniform cover. So a low rolling hills or same-sized trees. You don't want some short trees and some big tall ones. You like them all about the same. And take shelter in a motor vehicle with a hard top, not a convertible. We don't see too many convertibles anymore, but keep the windows rolled up. Also, take cover in a steel frame building. So lightning strikes. If you're boating or swimming, get out of there quick. Get out of the water quick and away from the shore. Avoid metal. Anything connected to electrical power, high places or objects, tall trees, open places, damp and shallow caves, tunnels, overhangs, flood zones, places obviously struck by lightning in the past, so forth. You want to assume a safe position if there's lightning coming your way. Squat or sit in a tight body position. Why? Make yourself as small as possible, right? If there's lightning hitting all around you. And you try to stay on an insulating material such as a sleeping pad or a life jacket or something like that if you can, underneath you. Take off any metal frame packs or toss hiking poles away from the ground. Do not lie down. If you feel your hair stand on end or your skin gets tingly, cover your ears with your hands and get your head close to your knees. That means you're going to get hit any minute if you're not careful. Spread groups out wide and about 100 feet or more between individuals. Keep everyone in sight if possible. So these are just some things that you can do. And this, I'll leave my, I've already given my PowerPoint to the other gentleman that was here. So you'll have it. So if you want a copy of this, you can have it, make a PDF of it. So, because I'm going through kind of fast. You can have cardiac pulmonary arrest, neurological problems, blindness, deafness. We had a situation in Walla Walla. They called me, said, "Come quick, Dr. Fleck, there's a kid that just got hit with lightning and you're on, come quick to the hospital." So I raced in there. And what happened was they were out having their little league practice and in Walla Walla, out in the residential area at a park. And all of a sudden, the thunder hit and the lightning hit all around. And so they said, "We got to get out of here." The coach, he says, "Okay, guys, pack up. Let's go to the first house we can find." And he went over and somebody knocked on the door and they said, "Can we all come in the house?" They said, "Sure, come in." So the coach grabbed this kid and he grabbed all the bats, aluminum bats, put them in the bat bag, and he was carrying the bats with the coach right in front of him, and they were running over to the house, and bam, he was hit right on his arm. And he went down. Heart stopped. And his coach, man, he got down and gave him CPR and saved his life. And we got him going again. They got in the house, took him to the hospital. When I got there, he was awake. It blew out his eardrum on one ear. When lightning hits, it always goes in one place and comes out somewhere else. His came out on the bottom of his foot. It blew a hole in the bottom of his foot where the electricity went through. And he lived. But because he had a broken eardrum, and because he had to have CPR, and because it went all the way through his body, I went ahead and sent him to Seattle Children's, and he did fine. He was fine. But his coach actually saved his life. And so, can you imagine with the lightning striking all around, he did CPR right out there with a chance that he would. But what happened was all those aluminum bats, that he had, he was carrying the bats, and apparently the lightning just hit right on that. And the lesson was to leave the bats out there. If they'd have left the bats, but they're taught, be organized, don't lose anything. But in that case, just leave the bats and get it. So, lightning injuries, serious. Follow the 30-30. Okay, how do you tell how far away the lightning storm is? Okay, what you do, if you flash to the boom, you see the lightning and you hear the crash, okay? So you take your finger, and if you hear the flash, if you see the flash and hear the boom, in 5 seconds, it's 1 mile away. If you see the flash and hear the boom, and it's 2 seconds, it's 2 miles away. It's at 10. Okay, so what you do is, if it's 6 miles away for 30 seconds, you start off 1 mile away for 5 seconds, 5 seconds, 10 seconds, 15 seconds. It's 5 seconds, yeah. So that's just a way to tell. So when it starts getting down here, flash to boom, 5 seconds, man, that storm is only 1 mile from you. That means it's time to take cover, get out of there quick, So, drownings, yeah.
We had a lightning storm last night. As a matter of fact, it was probably about half an hour when it
I'd stay inside. I don't think it's going to be. Some places have a grounding rod that you can also put. Yeah, Levi.
If you're really concerned, glass and porcelain are insulators. So like in fire watchman towers and stuff, for fire towers, on top of
Yeah.
whatever it is, they put their chairs and their beds in glass bowls or porcelain bowls and dishes.
Yeah.
So if you have porcelain dishes or glass casserole dishes in your kitchen or whatever, just take those and put them on one of these chairs and just sit on that with concern about
Yeah. It's good thing. So one thing, I want to hurry now because I still got a really important part to give, and you guys are probably getting tired, but here's the deal. For drownings, rule number 1, prevention. The biggest time for drownings is the first part of the season when people haven't been swimming. They're out of shape. The water's cold. And they haven't been exercising very much all winter. And they go out and they say, oh, I'm going to swim over to that rock over there. And they get out there and they get weak and they start, and that's how drownings can happen. So alcohol, most boating accidents and swimming accidents always involve alcohol. So if you think you might ever need to do a water rescue, you need to go and take some training from the Red Cross. But the bottom line is if you see somebody drowning, what you don't want to do is to get in the water and go try to help them, because they'll just climb right up on you and drown you too. There was a story that happened in Walla Walla. Vernon Clarenbow was a friend of mine, a nice kid. He was just a mellow kid. He was a theology student, just nicest kid as you could ever want. I knew his sister too. They were from Yakima, over by Wapato. Folks had a farm over there. And anyway, on a Saturday afternoon, he went into Walla Walla, and there's an irrigation canal that goes through Walla Walla. It's about 6 or 8 feet deep. And he was sitting there on a Saturday afternoon reading The Desire of Ages, just enjoying the sun, and these 2 guys came over, and they decided to go swimming. So they jumped in the canal, but then they realized that they didn't know how to swim because it was too deep. They apparently weren't good swimmers. And so the first guy jumped in and he got in trouble and he was going down. So the second guy, Vernon, watched him and he dove in to help his friend, and then he went down too. So not having ever taken any training in lifeguarding, he was a good-hearted kid and he just wanted to help, and he dove in and they all 3 drowned. And they had the funeral in the Walla Walla University Church, all 3 of the coffins brought in there. That was sad, man. It was in the summertime. It was sad. There's no reason for that. All he would have had to do is he'd go over there and give him a shirt and say, hang on to that shirt, and pull him over to the edge. I mean, you don't have to get in. Give him a stick or do anything. Throw him something. There's all kinds of things you can do. I used to teach water safety instruction and everything, and you can take a sweatshirt like what Levi's got on, and you tie off the top, and you just tie a knot in the sleeves. You go like this about 3 times, and you got a life jacket that'll last you for about 15 minutes. The air will just stay right in there. You can take a pair of pants, and you just take them, tie their legs. You go like that, and you got a life jacket for last you 15, 20 minutes. And if it starts to air escape, you just get some more air, and it'll hold. There's all kinds of little things you can do. Don't get in the water, though, number 1. So the rule is, even if you're a strong swimmer, now if I have to go in, and obviously the person is drowning, and I don't have a boat, I don't have a paddleboard, I don't have a life raft, anything, I'm going to go in. What I'll do is I'll swim out there, and I'll talk to them because they're panicked. They're just panicked. And they're still fighting. I don't want them to be fighting, so I'll just let them get tired. I'll let them to the point where they're actually going to go down. Because then they're going to fight me so much. And then I get about 10 feet away from them. I'm going to dive in. I'm going to go right underneath, and I'm going to come up right up by their legs. I'm going to turn their legs around. They come up, and I have them right around their chest, and they can't do anything. I take them right to shore. That's the way you do it. Or you can grab them in the head and swim backwards with them. There's all kinds of ways you can do, but if you don't have the training, you'll be like Vernon. That was a sad thing. So you can always grab something and throw it to them. Even if you get close enough, you could wade in the water and throw them something to grab onto. And of course, we have to have training for lifeguards about if they do get a hold of you from the front or from the back, there's all kinds of maneuvers that we know what to do, and we can get out of it quickly. But ordinarily, they'll grab a hold of you, and they're desperate, so you don't want to go in there. So it's a bad situation. You don't want to go out. If you have a paddleboard, that's great, but be careful because they'll pull you right off the paddleboard. What you can do is just give them the end of the paddleboard. You don't get close to them. And if they're fighting you, if there's a strong guy, just let them get tired and talk to them. Calm them down. Say, hey man, I'm going to help you. Calm down, calm down. Yeah, they're still fighting. Pretty soon they're going to get weak, and then you got to. Don't try to fight because you'll lose every time. Avoid panic. Panic is the sudden, unreasonable, and overwhelming fear that attacks you in the face of real or a danger that you think. It's not really that dangerous. Drowning prevention. Don't allow your group to swim in unsafe areas, murky water, water above a waterfall. I saw it over there by Palouse Falls. It's about 100 feet down. I saw some kids swimming up there in the pool just above the falls. That is serious. Wear life jackets, neoprene wetsuits, never swim alone. All boaters should wear U.S. Coast Guard approved personnel floating device and be skilled in managing their craft in local environment. Before doing any water activities, gather everyone together and have basic rescue aids discuss water safety every time. Don't swim or dive or ride in a small craft while under the influence of alcohol. Most drownings involve alcohol. Don't drive a speedboat at night. Don't let any kids drive a boat. On my birthday one time in Guadalajara, I got a phone call. I just got home from going down to the Lake Chapala to have lunch with my family on my birthday. And on the way back, I got a call that Caleb Sia, my friend, classmate, that they had a terrible accident and his 2 little boys were missing. And what happened, he and another guy were in the boat, and they let the little kid drive the boat, and he flipped it. And they never came up. And they desperately looked all over for him, and they couldn't find. It was a small lake. It was only about 15 feet deep, but the water wasn't very clear. And so now about an hour had gone by, so I went and I got a friend of mine, a Mormon friend of mine, that is also a certified diver, and we rounded up some tanks. It took us about 2 hours, hour and a half to get some air tanks and regulators and everything. And so we went out there, and it was already dark when we got there, so we couldn't do anything. And the mother was out there just screaming on the dock, and it was just terrible. And so we had to wait till the next morning. So we went out there the next morning, and we did a rescue thing where we put a rope, and we have knots in it, and we go in a big thing on the last knot. Then we come into the second knot, and we go underwater. We go all the way around, and finally I found one, and the fire department found another one. They had grappling hooks. They're just hooks that sink to the bottom of and the 2 little boys we brought to shore with the mothers and everybody crying in there. It was terrible. But that can be prevented. Don't let little kids that are 6 or 8 years old drive. And if you have to do it, have them sit on your lap and hold it. Make them think they're driving. But don't just let them have don't let people sit on the edge of the boat either. And I recommend for everybody that wants to drive a boat, get this new book. This is by the Coast Guard, and you can do an online course, but you can, this tells all the safety things to do about your boat. One of the most common mistakes is people go out there at the beginning of the summer and they get in the water, oh, it's so nice. And they get out there in the middle of the water and they realize, oh, we forgot to put the plug in. We drained the water out and we forgot to put the plug in. And now the boat is just kind of doing this, and it's half full of water. And you pull on the engine quick and you go to the shore, hopefully make it. And then you get there and somebody goes underwater and puts the plug in and now you got to bail all the water out. That's happened lots of times. But just little things like that, and especially if people are drinking. Never let people sit on the edge of the boat while you're driving. If you're using a kayak, you have to practice, if you roll over, how you're going to get out, because your legs are tight in there and people can drown. Now, if you're really good, you can just flip on up. But that's a whole another maneuver that takes a professional to do that. You don't even get out. You just flip upside down and you just with your paddle, you go right on up. But so you just have to be really careful. Never attempt a swimming rescue without it being a trained guard. Okay. So here's how you identify somebody that's in trouble. They're not drowning, but they're going to be soon. He can breathe and call for help. Or she can float, and she can scull, she can do this with her hands and tread water a little bit, but she's getting tired. The body position could be up and down, or it could be sideways, or it doesn't matter. They're making little or no forward progress, less and less able to support themselves. They may reach for rescue. If you show them something, they might be able to grab a rope or something. They're distressed, but they're not drowning yet. Now, how do you identify somebody that's drowning, actively drowning? Okay, they struggle to breathe. They cannot call out for help. Their arms are to the sides, audibly moving up and down, pressing down. They can't kick. They can't do anything. They're vertical. They're straight up and down. No forward progress. Has only about 20 to 60 seconds before they're going down permanently. This idea that they go down for the third time, that's bogus. They could go down 6 or 10 times before they go down. The question is, don't wait and see how many it's going to take. Just take care of them. They're unable to reach for or move even a short distance, so you're going to have to go out there and get them with a paddleboard, with a kayak, with a boat or whatever, or if you have to swim. Because at that point, they're not going to fight you anyway. So, now, how do you assist the victim in the water? You just continue to help them, and then you give them. Sometimes we have to give CPR on the way to the shore, if they're really out already. I'm going to go through real quickly. I want to get this boating accidents. We talked about that already. Wild animal. This is the one I want to do now. Then we'll be done. Before going into a certain wilderness area, know which animals you might expect to see, okay? If you go down there in the Everglades, what would we be looking for? We wouldn't be looking for moose, or they do have panthers down there, black panthers. They're cougars, but they're a special kind of cougars. They call them panthers. But they're going to be alligators and poisonous snakes and things like that. But up here, we're not going to have that. In Montana, we do have a lot of rattlesnakes, the timber rattlesnakes. But here, so far, I haven't seen or heard about any rattlesnakes here. You go down to Ritzville, in that area, there's lots of snakes down there. Pasco, lots of snakes. I've taken care of a lot of rattlesnake bites in Tri-Cities. In Montana, rattlesnake bites. But not around here. I've talked to a lot of people, and has anyone ever seen a rattlesnake around here? Okay, but not here. Yeah. In fact, you know that park as you're leaving on Highway 90, isn't it? The freeway south? The first rest stop, it says, watch out for rattlesnakes. Because we used to stop there sometimes, and there's a little sign that says, watch out for rattlesnakes. But after there, I don't think they're over this way. As soon as I say that, somebody's going to find one out here, but I haven't seen one. So if you're a group of 2 or more, you are less likely to have an encounter with a bear or a cougar. If you're by yourself, you're much more likely to have an encounter because you'll be quieter. You won't be making noise. Make sure you frequently make your presence known in tight places. So if you're coming around a sharp bend in the trail, or if there's a lot of brush, clap real loud, and then talk real loud, okay? It's not necessary to blow a boat horn and scare all the animals all the way down to Spokane. But basically, at least be aware and make some noise. In Montana, they have these little bells that you can put on your hat or on your coat or in your ankles, and just kind of ding, ding, ring, and then they can hear you come. So when you come to a huckleberry patch, you start sticking your leg when you come around the corner, and then the bear takes off because they hear you coming, okay? There are many fallacies about what to do or not to do when you meet up with a dangerous animal. There are many popular beliefs that are totally bogus. One of those is that if you're menstruating as a woman, that the bear is more likely to go after you. That's bogus. But I have a book here that's incredible. Backcountry Bear Basics. This is the latest and greatest, the definitive guide of what to do when you go out there and if you meet a bear. Totally different than when you meet a cougar. It's completely different. You don't run from a cougar. And probably you won't run from a grizzly either, because they can run faster than a quarter horse for the first 100 yards. I mean, they can go fast. And so that's why a can of spray, do you think I'm going to depend on a can of spray when a grizzly's coming at me 35 miles an hour from 60 feet away or 30 feet away? There's only one thing that you want to have at that point. Unfortunately, we live in Idaho where you can still have a 10 millimeter or a 357 or a 45-70 or whatever you need, because you don't have to kill them. You just shoot it off, and sometimes they'll stop. I've seen many videos where the cougar's actually coming for the guy, and all you do is shoot in the air, and the cougar scares them. We don't have to kill the wildlife. Now, if they're coming right onto you, that's different. A friend of mine that was raised in Africa, he said there's something that we learned about lions. He had some encounters over there with lions because his folks were missionaries. He said, if a lion is crouching and looking at you, and his tail is going sideways like this, that doesn't mean he's ready to pounce on you. But if he's crouching down and his tail is going vertically, he said that is bad news. And this is not bogus. This is exactly what they said. Now, I'm not going to sit around and look at a mountain lion to see which way his tail is going. But that's what they do. You know, their tail will go up and down. That means, another thing is they yawn when they're upset. So if a mountain lion yawns, that doesn't mean they're sleepy. It means that they're upset. So that's another trick I learned about mountain lions. So let's look and just see real quick. We have a lot of these around here. I have a video camera in my cabin in Blanchard up on Tower Mountain. 2 of them went right up on my front porch just this last winter. And so we saw tracks up there. There's a lot of them around. How do you know when there's cougars? Whenever there's deer, there's cougars. Anywhere in the country, in the western part of the United States. Okay? A lot of deer, a lot of cougars. The average mountain lion eats 1 deer a week. And to keep the population down, if there's too many deer, that means maybe there's not enough cougars. So, there have been 29 reported cases of fatal mountain lion attacks on humans in North America since 1968. There might be others, we're not sure. Fatal snake bites, bee stings, or lightning strikes kill much more people. Children are more susceptible, and the majority of fatal attacks, and I have a list of all the attacks here in North America. It's interesting, you can look at them, the dates, the ages. Almost all of them are under 16 years of age, and almost all of them were by themselves. And so almost all of them were children. So what are some things? Cougars may be provoked to attack if they're cornered or if you try to run away. So the worst thing you can do with a cougar is to turn and run. And they think you're a prey, and they'll come right after you. So when you go out in an outing to Priest Lake or up in the mountains somewhere on the weekend, tell everybody, if something happens, don't be running. Everybody stay together. Don't be taken off running, because that's the worst thing you can do. Standing still may also provoke an attack, because the cougar might think you're an easy prey. So if you can't run and you can't stand still, what do? You raise your arms and you try to look bigger than what you are. That's the number one thing. And then if you have your deterrent, your 357 or your 10 millimeter, you have it ready. Okay? You may be able to make the cougar retreat by intense eye contact, which you never want to do with a grizzly. If you look at a grizzly, I have a book that has all the grizzly attacks in Montana, The Night of the Grizzlies and all these books. Sometimes I can't sleep very good at night if I read those books. When people go camping in Montana, I said, just read this book. And one night they read it, and they were awake the whole night. And every noise they heard, they were ready to shoot, you know. And so, so what happens is, with a bear, you never look at them straight on, because that's just like firing them. They come and get me, you know. With a cougar, sometimes if you stare them down and wave your arms and talk real loud, then they will retreat. If they still keep coming after you, then you're going to have to do something. You have to make yourself look bigger. Now, if you have a child, don't bend over to pick them up, because when you bend over, it makes you look smaller. So you call the child, and these are critical things. And these guys have done this book here on mountain lion safety. This is approved by all the people in the parks and everywhere. So they've done a lot of studies on this. So you pick up the child, and you pick them up, have them come to you, or you go over to them, but don't bend over, because when you bend over, you look real small, and then the cougar might attack you. So some people have been able to survive by fighting off the cougar, fighting back with rocks, sticks, trekking poles, or even bare hands may persuade the cougar to leave you alone. This year, in Washington State, a woman was tackled off of her bike and mauled in the face by a cougar. 4 of her women companions engaged in hand-to-paw combat with the cougar for 45 minutes. And the women got the cougar underneath the bicycle. They put a bicycle and they were standing on it, and the cougar lifted him up in the air. And they fought the cougar, and at one point, he lifted him right up in the air, but they didn't give up. I mean, I'll tell you one thing, I wouldn't want to mess with those ladies. Because, I mean, they were brave, courageous ladies. I'd like to see what they look like, you know. They were trans or something, I don't know. But anyway, a wildlife officer was called to the scene, and he fatally shot. That was this year in Washington State. That just happened. Cougars are very sneaky, and most people never see them, even though they might be close by. Most people did not see the animal prior to the attack, because they see you, but you don't see them. You know, when this cougar was found a couple of years ago, and they tagged it, it was over between Priest River and Newport up in the mountains, and the game officers, they treated it, and they tagged it and everything, checked its health and weighed it and everything. It's the biggest cougar they've ever had in Washington State. It was in the newspaper and everything. And so they put an announcement in the paper about it, and they said, in Washington State, the officials from the state game department, they said, field game department, they said, there's at least 1,500 cougars in Washington State. And my son was in the gun store there, sports store right there across from Safeway in Newport, and they were talking about this, and the guy in there that runs the store, he says, that's all bogus. He says, there's 3 times more cougars than that. He said, if people knew how many cougars there are around here, they wouldn't even get out of their car when they go in the woods. But most of the time, the cougars they're timid and they stay away. They're not trying to attack people. If you corner them or something. Now, there's never been one attack where a cougar was trying to protect their young. For some reason, it's not like bears. So just because a cougar attacks you doesn't mean that she's got some cubs she's protecting. So most cougar attacks are under 16 years of age or younger children. Hunting cougars has not diminished the amount of attacks that we're getting. Most attacks have occurred in British Columbia. About 52% of all the cougar fatal attacks are in British Columbia on Vancouver Island. For some reason, there's a lot of them there. Montana has some too. They are solitary animals. Female lion home ranges are often less than 40 square miles, but a male can range for several hundred miles. But the male lion doesn't infringe on another male lion's range. But he'll probably cover about 3 or 4 female mountain lions' ranges. So the females stay closer to home. Females can come into breeding condition any time of the year, so kittens can be born year-round. There's no special season when they're born. The usual litter size is 2 to 4 kittens. The first litter is usually produced when the female is about 2 years old. She cares for her kittens until they're about 12 to 20 months old, and by the time they're a year old, they're pretty big, and then they just take off and they survive on their own. Mountain lions usually live about 10 years in the wild, but they're up to 20 years in captivity if they're fed right and everything. A major factor why they live only 10 years in the wild is because they kill each other. A lot of them kill each other. They get in fights all the time. Most of them, that's why they don't live very long, because they fight a lot. Like some people I know, they like to fight all the time, with each other. But they don't kill each other. They just kill each other with words, right? So another thing is that people are hunting cougars and killing them legally and sometimes illegally. And when cougars are starting to kill livestock, they get permission to go and kill them. And so they kill a few of them that they start eating cattle and stuff, and so they're killed. And then some are killed on the highways. I've seen a few along the highways that are run over by a truck or something. They're limited only to western United States and Canada and North America. They kill their prey by biting the throat and suffocating the victim. Their color, how can you tell a cougar? They're plain gray to yellowish to red, brown above, and they're white underneath, and they have a black tip on their tail, and their ears are black behind their ears, and their whisker areas, and their mouth is black. That's almost all the cougars. That's what they look like. And they have a short muzzle, not as much as a lion that's long. It's bigger. The tail length can be about 40 to 100% length of their body. And their total length is 6 to 8 feet, tail and body. The body is about 3.5 feet to 4.5 feet long. I have a picture here that one of my patients took. The weight is 75 to 160 pounds. The head is small relative to the body with a short nose. This is a friend of mine. He went out elk hunting, and he knew where the elk were, and they always come down to this field, and there was a tree down there about 30 feet tall, 25 feet tall. And so just before it got dark, he said, I'm just going to go get me one of those elks. So he climbed up in the tree about 5 o'clock, and it was starting to get dark. And pretty soon, he could see the elk were starting to come down. And then all of a sudden, he heard something, and it was almost dark. And he looked down, and this cougar was circling his tree. This very one right here was circling the tree. And then he was just kind of doing this with his claws on the tree. And then he said, I hope he doesn't come up here, because I'm going to have to kill it, and then the elk are going to run away, and I won't get my elk. And pretty soon the cougar started climbing up to get him, and he shot it, and this is what it looked like. That thing is huge. So anyway, he never got the elk. And this is what their tracks look like. This is a mountain lion up here. This doesn't work on the screen here. This is mountain lion, bobcat, and this is a wolf. Usually you don't see the claw marks on cougar tracks. We have a lot of them up there on our cabin on Tower Mountain Road. But I took some pictures off of here. So a mountain lion tracks. Do you notice something different between the lynx and the mountain lion? Check this out. You see this right here? These little notches here? The lynx doesn't have it, but the bobcat has has it. But these are bigger. Okay, and the front paws are usually a little bit bigger. So this is the track that you will see in the snow. So, how do you handle a mountain lion encounter? Okay, this is in closing now. You need to spend time selecting your travel route when you're going to go hiking. Pack your gear, water, food, check the weather, restock your first aid kit, let your family know your route and when you're going to be back. Recognize potential mountain lion country. Travel with a friend or group. If you're by yourself, you're much more likely to get an encounter with a mountain lion. Keep small children close to you. Do not let pets run unleashed. Try to minimize your recreation during dawn and dusk. That's when they're out. Early in the morning and late in the afternoon, just before dark. That's when they're going to be active. So try not to be out during that time. You should already be set up in your camp. Carry a weapon or a deterrent device. And a deterrent device, they said, is like a stick or a spray can. I don't think so. You know, that's not what I'd like to do. They have these 4570 guide guns that the guides all use up in British Columbia. And it's a 4570 with a barrel that's only 18 inches long, and they carry them. And that thing will take a moose or anything. Not that you have to kill these animals, but at least that will scare them. I have several videos where the cougar is coming right for the guy, and he shoots right in front of it, and it stops, and then it keeps coming, he shoots again, and finally it runs away. But it would have got him for sure if he didn't have that. So respect park warning signs. If you come on a sign that says, mountain lions in this immediate area, be careful, I would just turn around and go back home, or go somewhere else. How to know how to behave if you do have an encounter. So now this is what we need to do. Keep your cool. Recognize the lion's behavior. The way they act is going to be what you're going to do. And if their tail is twitching vertically, up and down, that's a bad sign. If it's twitching this way, you can say, nice kitty, everything is fine. Okay? Okay, if the lion, here's the thing, 50 yards, remember 50 yards. You're going to do some things if they're 50 yards away or if they're closer than 50 yards. Okay? If the lion is more than 50 yards away, change his position, and he directs his attention toward people and exhibits the following behavior, it may be only curious. This represents only a slight risk for adults, but a more serious risk to unaccompanied children. At this point, you should move away while keeping the animal in your peripheral vision and also have your weapon out and ready to use, just in case. Now, if they're less than 50 yards away, which is less than about half of a football field is 50 yards, where the animal is staring intensely and hiding, it may be assessing his chances of being successful at eating you. Okay? So, if he's intensely staring and hiding continually, accompanied by crouching and creeping, this means he's just about ready to attack. Okay? If he's close and he's still staring at you and he's creeping down, this is bad. This means he's ready to pounce anytime. Do not approach a mountain lion. Give the animal an opportunity to move on. Slowly back away, but maintain eye contact and close mountain lions contact if it's close. Mountain lions are not known to attack humans who defend their young or to kill, but they have been known to charge in rare instances. So there's a couple of videos I watched where they will come and charge at you and then stop at the last minute, but you don't know if they're going to stop. So the best thing is just to give them a warning shot. Do not run from a mountain lion. Running may stimulate a predatory response. Be vocal and talk or yell loudly and regularly. Try not to panic. Shout in a way that others in the area will know what's going on and they'll be able to come and help or else at least get away from there. Maintain eye contact, which presents a challenge to the mountain lion, showing that you are aware of its presence. Eye contact also helps you know where it is. However, if the lion's behavior is not threatening, in other words, if it's, for example, grooming itself or looking away, maintain visual contact through your peripheral vision and just get out of there. Back off. Appear larger, we already talked about that. Don't bend over. If you're with small children, first bring the children close to you and maintain eye contact with the mountain lion. Pull the children up without bending over. Band together if you're in a group with other children. Stay close. Be prepared to fight back if attacked. Try to remain standing. If you get knocked down, get standing up. If you have a gun, now's the time to fire it and scare the animal away if possible. If you don't have a gun, remember everything is a potential weapon. People have fended off mountain lions with blows from rocks, tree limbs, and even cameras. You fight with them if you have to. Defend your friends or children, but not your pet. If they go after your pet, I wouldn't it's too bad. If your children, okay, but don't go after your pet. It's not worth risking your life. It's enough to risk your life to save your children, but not for your pet. And I know some people's pets are like their children, but it's not worth losing your life. Adults have successfully stopped attacks. However, such cases are very dangerous and risky. I do not recommend physically defending a pet. Respect any warning signs. Teach others in your group how to behave. One person or child who runs could end in tragedy. So you tell everybody ahead of time, don't ever run from a cougar. If you have an encounter with a mountain lion, record your location details, notify the nearest park official, landowner, appropriate agency. Mountain lions have attacked people on horses. Trails. In 1996, a family including a mother and 3 children was trail riding on horseback in British Columbia. A mountain lion suddenly jumped from a bush at the 6-year-old son, knocked him off the horse, and attacked the child. The mother fought off the animal courageously, but she was finally killed by the lion. Surprisingly, the male only weighed 65 pounds. So it was a little one, but it was very aggressive. Incidentally, that picture I showed you with my friend that killed that lion, they checked his, when they skinned it, they checked his stomach. It was completely empty. It was hungry. Didn't have anything in the stomach at all. So he had something in mind other than just visiting my friend up in the tree. So this is a really good resource, this book that I have here. And also there's a field guide to mammal tracking in Western America that gives you much better tracking stuff. And the guy's name is James Halfpenny, probably a Native American. It's a really good tracker. So black bears and grizzly bears, I didn't have time to, I don't have any experience with this. I don't have any suggestions other than never look at a bear straight on. Always look away, because if you look at a grizzly, I've read lots of books about it. If you look at a grizzly, they're going to attack you immediately, even if they're 30, 40 yards away. So you can look at them by looking over this way, and they don't see that you're making direct eye contact. And the best thing is to read this book and then carry a heavy, powerful gun and use common sense, and you should be safe. The evidence of bear spray deterrent is not conclusive. Most of these aerosol cans only spray about 25 to 30 feet. A bear can outrun most quarter horses for the first 100 yards, so a little can of spray and a charging bear would be like spitting in the wind. How are you going to stop a grizzly? I saw one video where a guy's riding on a motorcycle in Montana, and the bear is clear out there with 2 cubs. And she sees him, and she's charging across the field, about 75 yards. And he just put on the accelerator, and that thing, man, it was just so fast it was over there. Can you imagine trying to stop it with a can of spray? There's no way. Not a chance. It's time to pray and at least fire a warning shot. Above all, don't panic. Please stay safe, make plenty of noise in bear country. Observe all warning signs and be ready to safely store your food. That's another thing. They have special storage things. You put them up in the tree with a rope. And then don't sleep right there. Sleep about 100 yards away. Summary. So we've discussed some of the most common summertime emergencies. In the near future, we may all face some very difficult economic, political, life situations. We need to be prepared spiritually, physically. Look for seminars in the future with spiritual preparedness for difficult times ahead. If you want an outline of this talk today, I think Mr. Mason can give it to you. And sorry I kept you here so long, but did I give the whole load of hay for you?
Thank you.
Yeah. This, incidentally, is the best crew they got. This is only 32. Probably 100 a year.
Yeah.
The two
sharing. And the good thing, I guess, of not having so many people is the drawing here, more likely. So we just have 4 different things. Sorry.
You better put one in quickly.
Fill out a form quick. Where is it? Right on the table.
First one.
Wait, she's gonna put hers in.
Well, I already pulled one, so we'll do the first one. First one is Maureen. So what I'm going to do, I'm going to let you choose.
What are
So
they?
this is a hammer.
Okay.
This is a solar charger. This is a solar light. Lantern. And this is
Thank you so much.
Hey Lisa, all you need is your name.
Okay, shuffle them up.
Okay, let's do this. Maureen, you can.
Oh, okay.
Hammer. Mosquitoes away.
That mosquito thing really works. According to the guys that fitters, you won't have any mosquitoes.
I think the mosquitoes don't really bite me. I'll take
You're
the
lucky.
bite.
Okay. Thank you so much. If anyone has any questions, I know Dr. Ron will gladly answer any questions. And I know you talked also about as far as what to put in a first aid kit. And so you talked about a lot of things through that. But if you have any other questions, feel free just to talk about them. Oh yeah, if anyone has an interest in a class on how to suture, we're looking at the future and maybe putting one together. There would be a cost for the suture kit, but if you want to put your name on here, that way we can contact you in the future if you have a desire to learn how to suture.
The suture kit is actually, we don't charge anything for the class, my time or anything, but the suture kit is about $35 or something. And what it is, it's got all the instruments, and it's got a foam pad that simulates just like the skin, and it's got cuts in it, round ones and square ones, pointed ones, and you practice sewing up those different things. And so I used to use chickens, when I went around the rodeo, I just get some chickens, and use chicken skin, but it's so thin that it pulls through real easy. So this is more like the real skin. And then we have videos of the Duke Medical Center teaching the doctors how to suture. And we just teach the simple ones, not all kinds of fancy stitches. So if you're interested in that, they have some people that are already signed up at off-grid outfitters. But if you want to have a special class, it's about a 4-hour class. And if you're serious about it, just put your name down and we'll try to figure out a time.
Thank you so much for coming. We'll take time here at the end if you want to come look at what Ron has or ask some questions. Thank you.
know what's really interesting about that one? That's the one that's got fishing line in it, and it's got stuff to start a fire in it.
How would you use it, just,
You know what I'm saying?
yeah, this fuzzy stuff?
You pull it out and have it start a fire. Yeah, that's the fishing line. And then it's got stuff that's really safe. Kind of 3 in 1.
I think that's, yeah,
That's kind of cool, right?
I think it's just,
These are fishing line gears that allow you.
Take a picture of some of this stuff.
yeah, I want to too.
And for the window breaking thing, sometimes it can be hard to get a good swing and break the window. So they have these little things. I have one in all my cars, and you just push it, and it has a little spur that pops out and breaks the window easier
This thing?
than that thing. Yeah. I can go grab it in my car and show it to you. And it has a cutter, and I have it on my, up where I can grab it on my visor. I loop it around there so I can just grab it, cut, break the window. Yeah, I'll grab it.
Thank you.
Yes, I took a picture of his name on it. Hoping I could find them. Hopefully it came out, because it's kind of faded. Why is it not taking it?